Hello everyone, and welcome to And Sleep. My name is Tommy Licatese. I have the pleasure of hosting OBGYN Dr. Natasha Fievre. Today, we will be discussing pregnancy and sleep. Welcome to the show, Dr. Fievre.
Thanks for having me, Tommy.
So what are some of the hormonal changes during pregnancy that can affect the sleep of an expectant mother?
With pregnancy, the body can go through a lot of changes. Definitely for pregnancy, the main hormone is estrogen. Now, estrogen causes the mucous membranes to swell a bit. As a result, that can cause some nasal congestion. Now, with that swelling, mom has lots of difficulty breathing at night, and she may already have obstructive sleep apnea from before. Now, we've also discovered that sleeping disorders can develop throughout the pregnancy because, as we all know, moms are expected to gain weight, and that can result in an increased BMI, which results in further breathing difficulties.
So why do you think it's so important to address sleep apnea in pregnant women?
Well, when it comes to sleep apnea, the concern is that it can worsen during the pregnancy. So it's very important that we get a handle on it at the beginning of the pregnancy. If it's a patient that already has a disorder, you want to go ahead and refer that patient to the proper channels, as well as getting non-invasive therapies such as oral appliance therapy for the patient. The mom is the powerhouse. She's the one that delivers all the nutrients to the baby. Most importantly, that oxygen. So if mom's having difficulty breathing and not getting enough oxygen in, that's going to compromise the baby's growth as well as the baby's full development.
So what are some of the tips that expectant mothers should practice?
First and foremost, we like to talk to the moms about sleeping positions. Pregnancy can be uncomfortable as you're carrying that additional weight, but also helping them to understand laying on their back actually causes that weight to push up against all their organs above the diaphragm, that being the lungs, which don't get to expand as much, so you don't get in as much oxygen. So we recommend sleeping on your left side, curling up your legs a little bit, getting a body pillow, or even using your partner as a body pillow if you have to, but just laying on your side to increase the blood flow back to the uterus and the placenta, as well as opening up those lungs and allowing you to breathe freely. When you have a mom who already has obstructive sleep apnea, she can only sleep on her back if she's using a CPAP. But now, if she's switching over to the oral appliance therapy, she can then sleep on her left side, which is the preferred side.
So can you explain the correlation between sleep and postpartum mothers?
Yes. But sleep and a postpartum mother, how does that go together? With that new bundle of joy, who sleeps? No. But all jokes aside, you definitely have to have that conversation with your patient during the pregnancy about making sleep a priority. Now, I always tell the moms, when the baby sleeps, you should sleep. It's very important to rest. It's going to affect everything. It's going to affect their mood. It's going to affect their milk production. It's going to affect how they even interact and view the babies. The risk for us and what we think about is postpartum blues as well as depression. Because if you're tired, how are you enjoying this bundle of joy that you've taken so long to bring here into this world? So we definitely tackle that issue very early on, at the time of discharge, when they're leaving the hospital, and when they come back to see us. This brings to mind one particular patient that I spent a lot of time just devising a plan on how we were going to manage life after the baby was here. Now, she was a single mom, single income, very worried about how she was going to be able to tackle doing what she needs to do for the baby, as well as doing what she needs to do for herself. So I was able to convince her to have that conversation with her mother and her grandmother to kind of sort of get on board. And so they made a schedule to kind of sort of balance everything out, allowing her to rest so that when she is on, and it's her shift per se, she's at her best for the baby. With this particular patient, I was a little saddened to know that the plan didn't go as expected. But that didn't discourage her or discourage me from coming up with a new plan. What she was complaining about is even though she got that chance to sleep, she couldn't really sleep. Now she was worried about all the things she needed to do for the baby. Would the baby be okay? What's going to happen when her mom goes back to work, when grandma gets back into the swing of things? So now, first and foremost, I encouraged her, get out, get some fresh air, clear your head, clear your mind, get your body moving and active. I told her she should do that for herself so that she can rest comfortably when it's that time. So devising that plan where she can actually truly sleep when the baby sleeps, she was giving her baby the best attention and care when it was time for her to maintain her shift.
Great. Well, thank you for coming on to the show.
Thank you for having me.
Well, that completes this episode of And Sleep, a Whole You social talk show series with Dr. Fievre. We encourage you to explore the rest of the episodes and visit wholeyou.com to learn more about sleep-breathing disorder treatment. The sleep professionals in this video series teamed up with Whole You to spread healthy sleep education across America and were paid for their appearances.